All right, welcome to the Young Turks coverage of the Medicare For All town hall that Bernie Sanders just had in Washington, D.C. A little bit later tonight, in about 20 minutes or so, we're gonna have Nina Turner on Rebel headquarters to talk about Medicare For All and what our revolution is doing to fight for it. She's the president of our revolution, which was started by Bernie Sanders. We'll also have some people who started watch events for this town hall. Curious to see how that went as well. All right, so Jimmy Dore, Cenk Uygur, John Iadarola with you guys, and I want to go through what we just heard there. So I've got it broken down into a couple of topics in my head. So let me start with numbers. So we just watched Bernie Sanders' Medicare For All town hall, and a couple of numbers stood out to me. First of all, 36 people, 36, I wish it was only 36, 36,000 people died last year and die every year because they don't have health insurance in America. Just let that sink in for a second. 9/11 was a little under 3,000 people. So that's 12 9/11s per year. But since it's not a spectacular event, it's not one covered every day, it doesn't happen to 36,000 people at once, we just ignore it. But it is a fact, it happens every year, and so it's unbelievable. And later in the town hall, they did an hour and a half. The last section was about how other countries handle healthcare and what we can learn from it. And in all the other developed countries, Norway, one of Donald Trump's favorite countries apparently, they had an expert from Norway on there who was a doctor from there, and they said it's unconscionable to think about not having insurance. People don't understand what that means. So Canada, same thing. So they're like, wait, I don't get it. You just let people die? And our answer seems vicious and deeply immoral to them. Yeah, we just let them die. And there was a doctor earlier in the program, we talked about people who come into the emergency room right before they die. And so the Republicans say, oh, you can go to the emergency room. They're like, yeah, but the person came in, they had no insurance, so they never did checkups, so we never caught their diabetes, so they come into the emergency room to die. And that's what we have in America. And so let's just acknowledge the depth of the problem. Then you talk about, how about finances? You know, Republicans always say, oh, it costs too much. No, it's the exact opposite of the truth. That's why it's maddening that this wasn't covered by cable news outlets, et cetera. We covered it, but it's so many of their advertisers put out this propaganda, which then you hear in cable news. But the reality is, it costs $9,800 per person in America, for every person, healthcare costs every year. So Canada has a life expectancy that is 3 years older than ours. They have a system measured by doctors and experts that is demonstrably better than us. They have better healthcare than us. You know how much it costs them? Well, if it costs $9,800 per person for us, it must cost them what, 15,000? We're 10,000, 50? No, 4,600. We cost 9,800, get worse results. They cost 4,600, get better results. So why are we doing this? Another doctor said, look, I spent half my time filling out insurance forms. Bureaucracy, we're talking about bureaucracy? All I deal with is insurance bureaucrats. Hey, my patient is dying, for God's sake, can I give them some sort of treatment? Well, I don't know, you fill out the forms and have them fill out the forms and we'll see what happens. And then she said, so some guy comes in and he's got a $4 deductible. The next person comes in, has the same exact problem, has a $1,200 deductible. Well, I mean, so one of them gets to live, the other one gets to die because he doesn't have the $1,200. The doctor from Canada who was on later in the program said, you know, we have no deductibles. And just think about that for a second. And what a sigh of relief we would all have as a country. In all the rest of the developed world, they say it's not practical. No, our system is the one that's not practical. It's the most expensive. It is double what almost all developed countries pay for worse results. And we stress ourselves out, like where are we gonna get healthcare? How can I afford it? Can I not afford it? So in Canada and all those other countries, no deductibles, no copays. On top of that, you've got no insurance forms. And this one actually got to me the most, I don't know why, but no medical bankruptcies. So no one has to ever worry, hey, I got cancer, so am I gonna lose my house? Am I gonna lose my business? Hey, my mom or my wife or my uncle, they had a stroke. Are we all finished? Are we all done? Because we all have to put all of our money in to try to save their life. and then we've lost our house, we lost our bankruptcy. For the rest of the developed world, they're like, what kind of a monstrous system says you get a healthcare problem and you don't have the right insurance, you picked the wrong thing, etc., and that's it, bankruptcy. If we could, we would have lower costs. And then finally, Bernie said, look, the good thing is we don't have to invent a new system. We already have it, it's Medicare. And it is among the top 2 most popular programs in the entire country. Social Security is number 1, Medicare is number 2. And all we have to do is let other people in. Another one of the businessmen that were in, and they had businessmen in there as well, and they said, well, look, we already have a system that works and that's incredibly popular, and it gives you some sort of relief. So like people are racing to get to 65. And they told a story about how people are coming and working at jobs they don't want to work at because it has decent health insurance. I actually know a story like that of someone who was really high up at MSNBC. In their 60s, he said he had to come back to MSNBC, come out of retirement because his wife was sick. And so they had to hang in there until they turned 65. So he had to go back to a job he didn't want to do, come out of retirement because they got sick. So then we just gotta make it to 65. Why do we, as a whole country, have to wait till we get to 65? We already have the system. Why don't we just let everyone in so we can all have a little bit of relief? And it's cheaper, so it makes no sense not to do it. Last thing for me is that here's why we do it. As Sanders again pointed out in the middle, the pharmaceutical industry alone, not the rest of healthcare, just the pharmaceutical industry, and not in campaign contributions, just in lobbying, spends $3.6 billion a year. So that's why we don't have a far more rational system that costs less, that covers people better, that allows us relief and decency and equality. The doctor from Norway said, we treat poor people, middle class people, and rich people the same. They all get health care. I mean, it made me think of what we used to talk about during the primaries, whisper of a dream. Could you imagine if in America we were all treated equally and it actually costs less money? And the only reason we don't is because we have an insane system where we allow them to spend billions of dollars corrupting our system through lobbying, campaign contributions. The number 1 donors are not the oil companies, they're not the banks, it's the pharmaceutical companies. And lo and behold, they have monopolies. Medicare, the one problem with Medicare is because the government is so bought and corrupt by these companies, they're not allowed to negotiate with drug companies. Again, the woman from Norway, the guy from Canada are like, what do you mean you can't negotiate with drug companies? You represent the people. How could the companies rule the people? Well, that's what we have in America, and that's why we have the disastrous system that we do.
Yeah, and I mean, look, as you point out, all we have to do is change the number on when you become eligible for it. We just put it down to 1, or I guess technically 0. And we know that government bureaucrats know how to do that. I mean, they keep pitching raising Social Security eligibility. They want to change that number. Okay, well, why don't we balance it out? Why don't we change this other number down there? We know that they can do it. That 36,000 is absolutely crazy. I would love to see, is there any other country that has sort of a per capita rate like that? And obviously we know we can expect that number is going to go up because the tax bill got rid of the individual mandate, and estimates say 13 million people will lose their health insurance because of that. And so that number is going to be higher now, more than 36,000. But yeah, the thing that I want to focus on briefly, and what I love about Bernie and why I love listening to him, is that they kept calling him like a pie in the sky progressive, but he's not. He's a fundamentally pragmatic politician. And he kept saying there, and I'm glad that he brought those healthcare professionals on to talk about this. Like, we need single payer, and I fundamentally believe that we're going to get it, and I don't think it's going to take too long. But that is not the end of history when we get that. As I try to remind people, there are people who haven't been born yet that will be born, grow up, go into politics, and then spend their careers trying to take out the single payer healthcare system we're going to set up. But even once we get the single payer healthcare system, that is just the beginning. I mean, in Canada, they're trying to make theirs better. In the UK, they're trying to make theirs better. That is just the beginning to a number of other foundational and structural changes we need to make, societal changes we need to make to take down the cost of healthcare and make sure that people get the best healthcare possible. This is just a very necessary and important first step in that direction.
John, I just want to add one quick thing to that. Bernie asked the experts, the doctors from Canada and Norway, Is there any politician in your country, and Canada had a conservative prime minister fairly recently, I said, is there anyone, the most conservative politician you have in Norway or in Canada, who would suggest taking away single payer? And they again, almost laughed out loud. Like, who would be crazy enough to suggest that? They'd get voted out of office immediately. Well, if every developed country that has single payer loves it so much that any politician anywhere in the political spectrum would immediately lose their job if they suggested taking it away, maybe there's something to that.
Yeah, but I think our country is so messed up. I mean, there are people who every year try to cut your Social Security benefits. There's people who try to kill Medicare and Medicaid every single year. I mean, these are insanely popular programs, perhaps the best government programs our country has ever had, and every single year we have to protect them from cuts. Well, we have sick politicians in our country.
Well, it's neoliberalism that wants to privatize everything, and so it's not even to one party, right? Because even Barack Obama had the grand bargain, which everyone knows was cutting Social Security and Medicare. So the thing that I loved, the thing I liked the most I heard tonight was when the woman from Cook County said, we already pay enough money for healthcare. We don't have to pay any more money to get healthcare for everybody in the United States. We don't have to pay 1 cent more. We already pay twice as much. So if people just thought about that, so when you have 30 million people left out of healthcare, even under Obamacare, we don't have to spend one more penny to insure all those people. That's just a mind-blowing thing. And then those 36,000 people wouldn't die every year. So that's the thing I think we got to keep pushing. Single payer doesn't cost any more money. That's the thing people need to remember. And not only, the only thing that was left out of tonight's discussion was the effect of income inequality on healthcare. I mean, on health outcomes, right? Because the greater the income disparity, the worse the health is for the poor people, but also for the richer people too. The greater according to a study, research shows negative effects of the health on even affluent, mainly because researchers contend inequality reduces social cohesion, a dynamic that leads to more stress, fear, and insecurity for everyone. So these two things go hand in hand. If we could get single payer, we would probably reduce some of the income inequality, right? Because people spend so much money on health care, and a family of four just to have insurance is up to $29,000 a year, according to. So you can address both things. You're going to single payer also addresses income inequality. The countries with the greatest income inequality have the worst health outcomes.
Super last thing. One of the businessmen talked about how Warren Buffett said that the healthcare cost is the tapeworm in the belly of our economy. It's actually hurting our businesses. It's not helping them. And then another one of the businesswomen there made a great point. She said it actually creates an incentive for companies to be more immoral. She said, if I have to pay I'm a decent person and I pay for my employees' healthcare, but the guy next door doesn't pay for their healthcare, says go get Medicaid, puts it on the taxpayers. Now they have a competitive advantage over me because they're more immoral than I am. Because I actually care about my workers. I want to make sure that they have healthcare. And that is an insane system. We should not have that system. And then Bernie pointed out, we're all subsidizing the Walton family who owns Walmart. I mean, because they paid the wages so low, they know that they've got to go to Medicaid. Their workers have to go to Medicaid, and we pay for their workers. And then they use that to drive mom and pop businesses out of business in the middle of America.
Yeah.
So none of this makes any sense. We've got to change the system. Luckily, the answer is really simple. We already have Medicare. All you got to do is say now everyone is eligible instead of just people over the age of 65. If you want to get the whole Young Turks show every single day, become a member, tytnetwork.com/join. And once you do, you'll be saying,
you know, I'm like a smart person.
Or you might say,
I think it's weird.
Or you might say,
oops.
No, that won't be that one. It won't be that one. It'll be great, trust me. tytnetwork.com/join.